Schizophrenia is a mental disease that affects millions worldwide. We often seek to know the causes, effects, and treatment associated with it. Did you know that there are myths and misconceptions of schizophrenia? Tune in to know more about it. What is schizophrenia? Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It can cause hallucinations, delusions, disorganized thinking, and impaired social functioning. Despite common misconceptions, schizophrenia is not the same as multiple personality disorder. Symptoms of schizophrenia include. Schizophrenia symptoms are typically divided into three categories. A. Positive symptoms, excesses of normal functioning. These symptoms involve a distortion or exaggeration of normal functions. Hallucinations, seeing, hearing, or feeling things that aren't there. Auditory hallucinations are most common. Delusions, strongly held false beliefs, e.g., believing one has special powers or is being persecuted. Disorganized thinking, difficulty maintaining logical thought processes, leading to incoherent speech. Abnormal motor behavior, unusual or excessive movements, catatonia, remaining motionless, or unpredictable agitation. B. Negative symptoms, reduction of normal functioning. These symptoms involve a decrease in the ability to function normally. Apathy, lack of motivation, difficulty initiating or following through with activities. Anhedonia, decreased ability to experience pleasure. Social withdrawal, avoiding interactions and lacking interest in relationships. Flat affect, reduced emotional expression, monotone voice, little facial movement. C. Cognitive symptoms, thinking and memory problems. Poor executive functioning, difficulty with decision-making and problem-solving. Working memory deficits, trouble holding and using information. Difficulty concentrating, easily distracted or unable to focus. While the exact cause of schizophrenia remains unknown, researchers believe it is influenced by a combination of genetic, neurobiological, and environmental factors. The causes are: A. Genetic factors. Schizophrenia tends to run in families, but no single gene is responsible. Having a first-degree relative, e.g., parent, sibling with schizophrenia increases the risk. B. Brain structure and chemistry. Imbalances in neurotransmitters like dopamine and glutamate are linked to symptoms. Brain imaging studies show differences in brain structure, including enlarged ventricles and reduced gray matter. C. Environmental and social factors. Prenatal exposure, malnutrition, infections, or stress during pregnancy may increase risk. Early childhood trauma, abuse, neglect, or significant stress can contribute. Substance use, heavy cannabis or hallucinogen use may trigger schizophrenia in predisposed individuals. On the diagnosis part, schizophrenia is diagnosed by a psychiatrist based on a detailed psychiatric evaluation, observing symptoms persisting for at least 6 months. Excluding other conditions, bipolar disorder, drug-induced psychosis, or neurological disorders. There is no single lab test for schizophrenia, but brain scans and blood tests may rule out other causes. Let's now look at the treatment options. A. Medications. Antipsychotic medications are the primary treatment. 1. Typical first-generation antipsychotics. Examples: haloperidol, chlorpromazine. Effective but may cause movement disorders like tardive dyskinesia. 2. Atypical second-generation antipsychotics. Examples: risperidone, olanzapine, clozapine. Fewer movement side effects but may cause weight gain and metabolic issues. B. Psychosocial therapies. Cognitive behavioral therapy (CBT) helps individuals challenge delusions and manage symptoms. Social skills training improves communication and daily functioning. Supported employment and education helps reintegrate into work or school. C. Hospitalization and crisis intervention. In severe cases, hospitalization may be necessary to stabilize symptoms. Schizophrenia is a lifelong condition, but many individuals can lead fulfilling lives with proper treatment. Adherence to medication, therapy, and a strong support system significantly improves outcomes. Early intervention in the first episode improves long-term prognosis. The interesting part of this video are the myths and misconceptions. These are: cross-mark people with schizophrenia are violent. Reality: most individuals with schizophrenia are not violent and are more likely to be victims of violence than perpetrators. Cross-mark schizophrenia means having multiple personalities. Reality: schizophrenia is not the same as dissociative identity disorder, DID. It primarily affects thought processes, not identity. Cross-mark schizophrenia cannot be treated. Reality: with medication and therapy, many people can manage their symptoms effectively. In conclusion, schizophrenia is a complex mental disorder that affects millions worldwide. While it can be challenging, early diagnosis, proper treatment, and social support can significantly improve quality of life.